Okay, listen.
All right, you all ready?
Everything.
All right, lower GI problems. The lower GI is the lower large intestine, aka ascending, transverse, descending, sigmoid, colon, and then rectum. Lower GI problems. Ready? So, inflammatory disorders. I know someone who has this, but so appendicitis. Well, appendix is, yeah, I guess it's lower. Your appendix is right here. That's your appendix. Diverticular, peritonitis, chronic Crohn's. All right. So I just want to let you know that right off the beginning that if you have, let's say, appendicitis or a colon bursting, anything bursting is going to lead to peritonitis. Peritonitis is deadly. I remember seeing a picture of it. The whole cavity is infected. Very, very bad. So that's like anything bursting, any colon bursting, whether from an obstruction or appendicitis burst, peritonitis can happen. Deadly infection. All right. So we're gonna go through all of these. What's important for you to know? What's not important? All right. Diverticulitis is the problem here. So diverticulum is just one little sac. Basically, let me see the picture. Sacs occur. These little sacs, it happens normally when you get old. From eating, from not eating right, you develop these sacs. Diverticulosis is more than one sac. So anyways, let me get back to that. So diverticulum is one sac. Diverticulosis is many sacs. No problems with diverticulosis. The problem comes with itis, diverticulitis. That's when it's inflamed, infection. Your white blood cells start going up, you start bleeding, all of that stuff. And you're gonna have to know like what foods to avoid to not clog up the sacs, stuff like that. We're gonna get to that later. So now, when we go through each and every one, this is gonna be a lot of, not a lot, but you should be ready to be able to select all things like. This one starts in the sigmoid colon. Another one starts in the other end. The other one starts over here. So that's a point of difference right there. So diverticulitis, it starts occurring in the sigmoid colon, as you can see from the picture. For Asians, it's the right descending colon. Ascending colon. Not important. This one, sigmoid colon, is important. Half of Americans develop it, the oocyst, the sacs, when they get old. It's very common. It's fine. But once they become oocysts, they can become itis. This is not too important. Basically, you're not eating fiber, and you're keeping food there. You're not pooping when you feel like you have to poop, and it starts sacking. It starts the aneurysm, you can think. Right? It starts creating sacs. And then once the food gets trapped there, bacteria love it, and then it gets inflamed. This is not important. This is a big bunch of words. It's not important. You just have to understand it simply. These words are not important. You know what a diverticulum is? One sac. You know what oocyst and itis is. So oocyst, all of them is preceded by constipation. You're not emptying your bowels well, right? So constipation, then the sacs occur. Relatively mild signs and symptoms. People will live with the spine. Half of Americans get it at 80 years old. Your bowels might be a little weird. You might get diarrhea, really. What the point is trying to make is no problems. That's the main thing with this. Maybe a little distension. Not really. No problems. That's the main thing you got to get here. Now, itis is the one you have to know. Of course, let's see here. What is blah, blah, blah. So itis is it starts inflaming. Let's look at this picture here. Once it starts inflaming, it starts narrowing. Inflammation narrows. Inflammation happens on the inside, and then it pushes outwards. So it narrows, so you get those narrow stools. They get even more constipation. Weak, fatigue, anorexia. Now, this part here, remember, it happens in the sigmoid colon, it's left lower quadrant. Another one happens in the ileal ascending, so that's right lower quadrant. That's another point of difference that you have to know. Know where's the pain. Appendicitis is right lower quadrant. This diverticulitis is left lower quadrant. they have the really nausea vomiting. They get the fever because it's an infection / inflammation. So they get a fever. You're going to see their white blood cells are up. Their white blood cells go so far up, they go into this, leukocytosis. Enormous high amount of leukocytes, aka white blood cells. Chills is a sign of, fever-like symptoms. Fever, chills, anorexia, not eating, stuff like that. Narrow stools. So if it's like a select low for diverticulitis, you're going to pick left lower quadrant. You're going to pick narrow stools. You're going to pick heavy constipation. Some of them are diarrhea. This one's constipation. So that's another point of difference. The fever, chills, the white blood cells, there's going to be slides on it you have to know. We're going to get to it. So I'm really telling you what I said. Underline it, make a chart that shows you all the differences. Understand, it's the sigmoid colon. So if you see here, left lower quadrant is the pain. Appendicitis is here, so it's right lower quadrant. And if there's another problem, it's in different areas. Like if it's a liver, the liver is all the way up here, it's right upper quadrant. But that's like another thing. So, CT scan, that's what they prefer, I guess. Colonoscopy is they put the tube in your butt and they see what the picture. Scopy means the scope, so colon scope. And they could biopsy, that's what BX means, biopsy. You dig a piece to see if it's a cancer. Alright, barium enema, certain ones, we give barium enema. This one is contraindicated when it's diverticulitis because it's constipated. Anything that's already constipated, like with obstruction, there's going to be no barium enemas. But barium enemas help you light it up on the X-ray or something like that.
So it's not a test that they would do.
Not if it's, they would do it if you're diverticulosis. If you're itis, contraindicated. No. Labs, you see white blood cells are up because it's infection / inflammation. ESR is a sign of inflammation. Erythrocyte sedimentation rate, ESR. If that's up, you have inflammation somewhere in your body. Complications, if the sacs burst, peritonitis, which is one of the worst. Abscess can occur, that's a lot of white blood cells, and it becomes an abscess, like a big pimple. Alright, you have to know what's a fistula versus a fissure, and which is which. So I'm going to tell you right now, and I'm going to re-explain it when I get to it. Fissure is like a crack. Once the crack gets bad enough that it starts penetrating through, it becomes a fistula. For example, fistula is a pathway between two things. And I'll know the best way to understand it. I had a patient who developed a fistula from diverticulitis. It fistulaed to her urinary tract. So she was peeing shit. We were flushing her bladder, pulling shit out. Flush, pull shit out. Flush, pull shit out. It was ordered every hour. So poor lady, right? Well, they're going to surgery it and try to fix it. So that's a fistula, a pathway between two things where it shouldn't be. She even says you can fistula to your skin, and now you're pooping out of an artificial stoma, that kind of thing. So know the difference between fissure and fistula. Certain ones have fissure, certain ones have fistula.
She said tunneling, another word.
Tunneling, a tunnel path.
Communication.
Right, it's a pathway, bad. There's also, there's bears in China that, the bears in China, they like to put a fistula to their liver because their bile apparently is something, and they're upset about this. They create fistulas in the bear's liver so they can get their bile. Apparently it's something really valuable. So it's really unhumane. That's how I remember it. Fistula, bad. Rectal bleeding can happen because those inflammations, they bleed. Alright. Diet, initially, what's CLD? Clear liquids, and then they work their way up. So better foods. Increase your fiber so you don't get the constipation, which caused this in the first place. Don't eat too much fat. It's all going to be repetitive. Demerol is the opioid that's given to pregnant women, if you know, something like that. Antibiotics 7 to 10 days. We want to make them poop because their problem is constipation from the narrowing. One of the other ones is diarrhea, so we don't. This diverticulitis is constipation. We want to make their bulk forming, high fiber, prevent the spasm. Remember, we said spasm even makes it tighter. So we give antispasmodics. Buscopan is the name. Buscopan is the name of the antispasmodic. Thank you.
Shields the
Now,
stomach.
also, I see the note, we don't give morphine because morphine's big side effect is constipation. So instead we give Demerol. What were you going to say? Is that what you
That's
said?
what I was
Increases intraluminal pressure.
Yeah, something like that. It slows you down and you get even worse constipation. Diverticulitis, we're worried about constipation. We prevent it, not morphine. NPO, if the patient is vomiting and they're distended. What happens is that they don't want to eat. It's too constipated. They vomit everything. So we give IV fluids to replace it so they don't get dehydrated and lose electrolyte balance. The big problem with dehydration is electrolyte imbalance. So we give them the fluids. The NPO by mouth, we give fluids to the vein. All right. CT guided drainage. They drain the abscess through the skin. Percutaneous means through the skin. It's contraindicated if you already have developed peritonitis, bleeding, or if it's obstructed. I don't know how important that's going to be. I really am not sure so far. But I remember this was very important to know. So apparently, bowel resection, what they do is that since your sigmoid colon, oh, there's a picture coming up, right? So since the sigmoid colon has a problem here, what they do, this doesn't have to be this way, but there's two treatments. One is that they cut here, and they create a stoma, and they let this part rest. Once it's rested and healed, they reattach it. So it's temporary. You can have temporary colostomy. I just learned this in nursing school myself. A colostomy is not permanent. The bag that you're pooping into is not permanent. They can do that, or cut it out, and you have the stoma. So that's Hartman's when you have one stoma. Double barrel is two stomas. That's the one thing I know for Hartman's.
Wait, why two stoma?
Because you have the beginning and the end.
Something like that. I don't know why.
Just used to get rid of inflammation.
YouTuber.
All right, next thing is nursing process. Health history, physical, constipation, acute pain. So they get
Sometimes they connect it all one time. You don't have to come back.
Yeah, we're gonna get to that. Constipation, acute pain, pain management, blah blah blah. Fluids. All right, here's another thing I want to mention to you that's going to be repeated 100 times in this lecture. The big thing with the lower GI, the large intestine, the colon, is that it absorbs water. Like the small intestine absorbs mostly nutrients and stuff. The large intestine absorbs water. So when you get any diseases, any inflammations, any infections, you don't absorb water as well. So that's why main things they're worried about is dehydration and electrolyte balance, because your colon's not absorbing it. We're gonna repeat. That's gonna be repeated many times, so you should know that. Muscle tone, manage complications. Nothing else is important here. Nursing diagnosis: constipation, pain. These are all the things that happen. Constipation is their problem. Pain is gonna be all of them. Visual knowledge: infection, diarrhea. Not really. It's constipation for this one. Move on. It's not important. All right, so that's diverticulitis. Know it's constipation. Know left lower quadrant. Know the Hartman's procedure. Know that. So that stuff is all stuff that I have to know. All right. All right. Now for the next two, Crohn's and ulcerative, you better be ready to select all the signs and symptoms for that. So, not the risk factors, but the signs and symptoms, because they're very different. So we're going to get to that right now. Smoking is bad. Okay. Now, let's start with this. One, Crohn's, one of the first differences is that it extends through all the layers. Let's jump to ulcerative. It's only the mucus layers. So, now here's another thing that you should connect. Since it's only mucus for ulcerative colitis, it only ends up developing fissures, not fistulas. Whereas in Crohn's, since it's all the layers, it can easily develop a fistula, the pathway. That's one key thing you have to know. So if you see select all Crohn's, you're going to pick fistulas. Fissures can occur, but really fistulas for Crohn's, fissures for ulcerative. That's one difference. And it has to do with all the layers in Crohn's, so it can pass right through. And for ulcerative, it's just the mucosa. We're going to get to that. So So that's one difference right there. Be ready. This one occurs in the distal ileum. So let me get a picture. Distal ileum is here. So what kind of pain is that?
Left, right.
Right lower quadrant. Ulcerative colitis, you're gonna see that, let's get to it, that this happens at the rectum area. So their problem, again, is the left lower. So we're gonna get to that. So for now, no Crohn's, no, it's all the layers and fistulas, no, it's the distal ileum, right lower pain, right lower quadrant for Crohn's. Periods of remission, exacerbation, that's for all of them. And another thing you should know about Crohn's is cobblestone. It looks like cobblestones. The other one doesn't. As you see here, cobblestones. You know, like you walk in Manhattan, I hate those streets. Driving is a bitch on those streets. So,
What does it look like for ultrasound?
I'm not sure. I forgot. But we're gonna see. Yes.
How would you describe a fistula?
Pathway. Like you can see
No,
here.
I'm just saying. Like,
Let's say this abscess was gone, that's a fistula now.
so it's a hole.
Yeah, it's a pathway, a tunnel.
Pathway.
So another area that's not supposed to be like my patient was tunneled to the urine, and now she's peeing shit. So it's because it goes through all the layers. Because
No, sorry, I was late. I didn't realize you guys went over it.
Jim, we need to leave.
Yeah.
We need to
All right, that's
So the ladies are eating, okay? All right. So edema, thickening of mucus, ulcers, fistula really for this one. Narrowing problem. I'm not sure what else. All right, here it is. Right lower quadrant, especially after meals.